Well, data available shows that several epidemics have severe psychological impact or outlook on the population. It is not clear yet what the impact of COVID-19 will be as we keep learning with different cases.
While there are some insights available as regards the death-infection ratio, the big fight now is to squash the misinformation pandemic. In a bid to give clarity to this, we have Dr. CHIMAROKE OBIALO, a mental health specialist, to talk to us. Doctor, it's a pleasure talking to you this morning as regards this. We used the term while we were talking before we got on the air as regards the intellectualization of the process. Doctor, what does this mean?
Good morning. Good morning. It's a pleasure to be with you here today. Thank you for having me. Intellectualization is a coping mechanism to handle stressful situations. In my practice, I tend to apply that a lot. I tend to get my clients to apply that a lot. And I'll have to say that during this period of the corona pandemic, I've had several clients of mine present with exacerbation of the anxiety disorder, or people coming down with anxiety disorder for the first time. And we find that intellectualization, which is pretty much in layman's terms planning, having a plan, a specific plan to attend to their own exposure or to their own stressful situation. And I find that it's quite helpful. And it's actually documented that intellectualization can significantly reduce the anxiety experience during stressful situations. And yeah, that is one in several tools in our that we use in our practice. Apart from intellectualization, there is sublimation and sublimation, humor, catharsis. These are what we call mature coping mechanisms, which are characterized by us realizing the problem that we have. Someone said that there's a tendency for people to feel ashamed for being anxious about this issue, and that might lead them to denying that they are anxious, which is an immature coping mechanism. Really, that's the denial, amongst others. So in our field, we encourage mature coping mechanisms that include intellectualization. Let us address what we have on plate, and we are getting the results, and we are also keen to let people know that there is solutions available to address what they might be going through. There are several hospitals that have dedicated emotional health practice. That emotional health is a euphemism for psychiatry, but it addresses that we focus on people's emotional response to stressful situations.
Dr. Obialo, at a time like this, when we're seeing increased social distancing, isolation, or quarantine, what is the general concerns for population like that of Nigeria, with already existing majority with mental health illness? Is it anxiety? Is it social eating disorders, stress? What exactly should we be looking out for here? Okay,
well, the scenario that is developing is considered significantly stressful, and everybody will recognize that it is stressful. And stress inevitably brings about anxious feelings. And the truth is, anxiety is not necessarily a bad thing. It gathers the individual to confront the issue that they face. It only becomes a problem when they are crippled by the anxiety they're experiencing. So yes, the anxiety disorders are the most common conditions we might have during this period, but it might lead and precipitate other forms of mental health issues, especially if they already existing prior to the stressful situation.
Okay, Doctor, real quickly, there are people that are currently coping or trying to cope with things like anxiety disorder. How much more when you put a case of coronavirus on top of it, that some people in some quarters are already saying is the end of the world? There's pandemonium everywhere. There's mass hysteria everywhere. How do you cope?
In my practice, I have found myself having to address the infodemic, the information, the wrong information being spread across all media presently. And my clients, when they do present, like one that I had over this past week, with over expression of over-practicing of the social distancing or them openly telling me how anxious they're feeling about it. I try to interpret the information at hand and help them to recognize how to handle the information that has been exposed over this period. I think, first of all, you have to develop a routine that suits you, that usually would involve identifying a reputable source of information that you have to work with. There are several websites that are putting out clickbait-worthy headlines, sensational headlines. And people have to realize that they should not be taken advantage of, that people want to make money and they're putting out a lot of wrong information. Because when you see some of the information out there, you wonder what is the incentives for that, okay? So once you have a reputable source of information, that is one step. Then after you've gotten the information, I realize that as practitioners, medical practitioners, we need to help people understand the information that they have at hand. Many people have not realized that in places like China and Korea, where there has been widespread testing of the general public to identify people who have come down with this issue, that the mortality rate is 1%. Every time I tell most of my clients this, that the mortality rate in widely tested areas means that their own sample should be trustworthy instead of areas where they are not spreading, there's no widespread testing. So when you come out and tell someone that it's 1% mortality, and that actually means that 1 out of 100 people that get the condition are expected to die, they go like, doctor, are you sure? But that's what 1% means. And we try to describe how much exposure they are at risk of, because there are other information out there which includes that when you say that it affects elderly people, it affects people with immunocompromised conditions more. Because out of that 1% that end up dying, we find that there's a predisposition of people who already have immunocompromised states and the elderly. And in our own country, we are peculiar. We are quite different from European countries, and the East Asian countries have already been affected by this pandemic. In Nigeria, for instance, the population of elderly individuals is 3%. That is individuals who are 65 years and above, is 3%. While that of Italy, for instance, is like 25%. And in Korea, it was about 12%. So you find out that we have fewer people who might be exposed to coming down with this problem. And that we have the low population of elderly people in Nigeria is a reflection of our life expectancy in our country, which is under source of concern. When you find out that our life expectancy is just about 55 years old. So we as a people should take advantage of this attention on health to ask the relevant questions like, why do we have a lower life expectancy? But when it has to do with corona, you realize that we're in a different situation from these other affected countries, and we shouldn't necessarily expect it to be expressed or the pandemic to go in the same route as it has affected them. And also, there is the smoking rate in the country. The population of people that smoke in our country is significantly less than in Korea and in Europe.
We'll come back to talk some more about the coping mechanisms, breaking it down for people who are in self-quarantine at this time, especially in Nigeria and Lagos here. But I'll talk about the kids, the children, because more often than not, we know that they feed off the adults around them. And I do know that a lot of parents are being driven into the wall at this time with the schools shut down. What are we likely to see with children who would not stop asking these questions? Why are we home? What is corona? Summer break is coming up. Are we not going to go on summer? These questions can really drive you up the wall.
Like in most cases, the children would feed off their parents. They would pick up signals from their parents. So their parents need not just to take care of it for themselves or adjust appropriately to the situation for themselves, but for the people that are dependent on them. For the parents, you asked the question about the coping mechanism. I had mentioned earlier intellectualization and all handling of the information. But there are certain things you can actually do to handle stressful situations. You know, at times when people are going through actually in an acute episode of panic or anxiety spell, it's not always helpful to tell them to calm down. It actually tends to draw attention that they are anxious and make the situation worse. But you can always encourage them to take a deep breath. And I would encourage people during this period to regularly make an effort to have breathing exercises, taking a deep breath and running things through. Taking a deep breath, hold it for about 10 seconds and release it slowly over 10 seconds. The truth is that oxygen does improve the mood. And all we're doing is doing the breathing exercise is to ensure that we take advantage as much as possible of the atmosphere, of the oxygen around us, okay? So breathing exercises, you can do that a cycle of about five cycles, then take a break, okay? But and mostly when you are contemplating issues, when there's something you're actually thinking about that's inducing anxiety in you, take a deep breath, have some breathing exercise. And in support of the breathing exercise, you realize that yoga, exercise, dancing, good posture, all these things that are recognized to improve individuals' mindset and improve their mood are characterized by the repeated conscious effort to take the deep breaths. And it's significantly very helpful. It is. Apart from that, the breathing exercise, you should have a routine. Routines do help. Even when I mentioned about the reputable news sites that you may have, you should regiment your exposure to them. Dedicate a particular period of time, a limited amount of time to reading about the news. Then after that, have a busy lifestyle, even when you're confined in the hospital. Yes, with your children, have play times or expose yourself to whatever you can watch on the streaming services or on TV. And yeah, they play, and obviously there's going to be the academic sections, which you also have to incorporate. That is homeschooling, some form of homeschooling, which you have to incorporate within your own routine. And yes, did I mention exercise? I can't reiterate it enough. During this time, someone was asking, all exercise are not contact sports. You can jog, you can walk around, you can find something that would require you to still observe the social distancing rules that are recommended.
All right. Real quickly, Doctor, thank you so much for that. In fact, I tried the breathing exercises just now, and I felt better, I should say. Let's talk about, we don't want it, but there are some eventualities that will come out of this. When we start to have extended shutdowns, partial shutdowns started today, not too much cars on the road, people have to be at home for longer days. They've never been at home that while in their lives for longer days like this. Some people lose their mind. It makes them lose their mind. They're like, I can't go out, I can't earn an income. Goodness me, what is happening to me? How do you maintain that stability of mind when you have to stay out for a long time, you're losing it?
You're asking about how to handle the protracted stay at home during this period?
Yes.
Okay. Yeah. It still ties into what I had mentioned earlier about having a plan. And in your plan, we have to factor in that this thing might take very long. It might actually be quite long. It'd be nice to err on the side of caution by having a plan that for a protracted period, and still be hopeful that it will be shorter than expected. But the plan should err on the side of caution here. So once we expect it to be this long, it reduces the shock of it. What comes to mind is that an unexpected slap is better tolerated than a slap that comes out from nowhere. There's a significant shock to the system. So when you factor that into your plan, it's still part of the intellectualization. And in the intellectualization, you break down every aspect of the situation. Recognizing the drawbacks, you do not ignore them. Recognizing the disadvantages. Yes, the prolonged stay at home is there. The loss of income is there. What else again is there? The possibility of death, of self.
Sorry to interrupt you, but let's go on a quick break and we're back to talk some more. Stay with us. We'll be right back. Welcome back. You're still watching the morning show here on the Rise News, and we have with us Dr. Chimaroke Obialo, a mental health specialist. We're looking at the psychological impact, if any, of COVID-19 on the population. Thank you so much, Dr. Obialo, for staying with us. Now, you have given some advice on how to cope, coping mechanisms, so to say. But I want to be sure and for you to clarify, is this for the general population or for an individual who has been infected by the virus? And if it is not, what are the likely psychological effects or impacts COVID-19 would have on an individual who is in quarantine, perhaps with other patients? Secondly, the issue of stigma. When all of this is done, what are we likely to see?
Yes. I was describing a scenario where for the general public, the great experience and how to handle the stressful situation, I did not dove down directly for people who might be affected. Yes, and as you said, there might be there's risk of stigma associated with it, bearing in mind how individuals are presently responding to related issues of coronavirus infection. It's left for us health specialists to engage the public in a robust manner as much as possible. That is why I'm happy to be here on your show, to give people the true picture, give them the information they need to make judgment calls on, and realize there is no reason to be stigmatized. There's no reason to stigmatize against someone for being exposed to something that has been that is related to the common cold. The symptoms for most people will be mild. Out of 100 people that get it, close to 80 might not even be aware that they've encountered it. 20 might, out of 100, 80 might have very mild symptoms, and 20 might come down with significant respiratory compromise and illness. Okay, and 1% will die. But regardless, the people that come down with the illness, there is really no reason to stigmatize against them, because inevitably they are not at risk of any harm to anybody. The illness, by its nature, is an infectious disease and is not something to be ashamed of or to shame people over with. We should be compassionate during this period, realize that in taking care of this illness, we are all in it. And it's not, during a pandemic, we shouldn't isolate ourselves. We should reach out to loved ones. We should, in our behavior, aim not to pose a risk to other people, as typified by people hoarding medical product, safety wares, and other provisional items out there. There's a need for the public to have an appropriate response to this condition, and I believe it's for related for the health specialists, for the doctors, the healthcare workers, to educate the public as much as we can. I'm confident that the public will get it.
Still on this, I want to talk specifically about a certain social media site that is, where a lot of people are reached. I'm talking about WhatsApp groups, specifically. I had to fight, and I had to leave a WhatsApp group recently because somebody circulated a message making the rounds, like you know about us, so about somebody talking to a specialist in Luth, and the person peddled fear in such a way by saying that they even said that even if you recover from coronavirus, 50% of your lung functions will be depleted. So you start to hear sorts of messages like this. Is this the time to stay off WhatsApp groups?
Even before this condition, people should be more savvy, should be wiser in their consumption of social media and information from it, especially WhatsApp. You have to decide what group would be suitable for you, and because beyond this, they also peddle inappropriate information in a wide-ranging issues. So, but as per concerns this, one should be confident with their own recognized, reputable source. Regardless of what you might hear other people peddle, you should. I heard some encounters, I heard some news that was inappropriate. All I had to do was go and check on the WHO site, and thank God, Facebook made some effort to counter the prevailing poor information by developing a dedicated World Health Organization information site page on their WhatsApp group. So you can just, on the WhatsApp page or so you can just get all the information you need from the regular bulletins that the WHO is putting out. So 50% of lung function lost, that is an exaggeration. The lung does heal significantly well following such infections, really. So I doubt that info, and I haven't heard about it, that's all I can say.
Anyway, it's been debunked that it's a lie, so that's the good part of it.
Yes, the hospital did come out to say that it's false. But Dr. Obiallo, let me now ask you, I mean, Nigeria has 2 discharge cases of COVID-19. Unfortunately, nobody has been able to access them as regards media to tell, you know, what their state of mind is, what was the process like, an experience like. And I do understand why that is so, because they also need to keep their distance because of the fear of stigma. But as a psychologist, can you paint a picture? Walk us through the mind of someone who has gone through this process and is now healed. You talked about coping experiences for the general population, but can you give us a coping experience for someone who is in a quarantine center? It's not exactly a suite at a 7-star hotel. You have other patients with you. So what will be the coping mechanism for them there? And then walk us through the mind of a person who is likely to have gone through this experience of COVID-19.
Okay. Well, I'm a psychiatrist, and I'm involved in not just analyzing individuals and also actively treating them. So I have been part of teams of doctors that have handled individuals that have been treated for infectious diseases, for life-threatening conditions, which this infection could be described as. So the same scenario obtains that the individual really, the quarantine center, yes, there is the individual would experience a significant, the barriers that are set up for the protection of the service providers and might be a bit shocking to individuals, but they will settle down soon enough and appreciate the need. You know, the quarantine facility is not a gulag, so to say. It might not be a 5-star hotel, but there's effort made to ensure that these individuals are significantly comfortable, because we need them to be comfortable to address the ongoing infection. They recover better in a comfortable scenario. So their meals it would be appropriate, and their sleeping arrangement would be above average and comfortable for them. Bear in mind, we were just 2 people. That we have enough resources to handle 2 people that might have come down with that. Okay, and I think most hospitals are well equipped to handle that. And thank God they didn't need respirators, which might be in short supply in the country. But the psychological profile of an individual who might have experienced this will not be so different from that of an individual who has been treated for, what's it called, life-threatening diseases. And the 2 individuals presently, they are still unknown. Their privacy has been preserved. So they are most likely not going to be recognized or hounded, so to say, by the media or individuals. So that's one of the reasons why their privacy is preserved, unless they choose and they are comfortable talking about it. And it will be quite beneficial if they're able to tell individuals, share their experience to help dissuade any lingering fear of what the experience was. Because what obtains outside the country, where people are treated for the corona infection, you know, if you want to know how has it been, what's the experience like, they are outside this country, people are more open to discuss about that. And when they talk about it, they do realize that some described it as not having any effect on them per se. It was a very mild flu symptoms, like what the actor Tom Hanks and his wife have described. And the actor Idris Elba said his own was asymptomatic. But people who were acutely ill, there was that difficulty breathing. And with most cases of conditions that compromise the breathing, like in asthma, there is increased anxiety. Where the psychiatrist in the team would come in. He would come in and have to help alleviate that individual's distress. There's obviously the improved breathing regime, whether it's with a respirator or with airway medication to improve air in the lungs and all. But even for them, breathing exercises can come in very handy. That conscious effort to breathe in, hold the breath, release it as much as possible. And along with that, if there's compromised sleep, which is needful during this period, because we have to ensure that the individual sleeps appropriately. We would, I'm sure going into the medical and the technical aspect of it, but all I'm trying to describe is a situation where their needs will be met and their distress will be minimized as much as possible. And yeah, they should be able to engage with the public without much handicap.
Hello, Doctor, if you can hear me, I just want to ask this. You've got about a minute to comment on this as we start to wind things down. How do people deal with things like PTSD for people that might have lost one or two people as a result of this, or the experience is just very traumatic for them? Do we have enough psychiatrists? Do we have enough counseling network and mechanism for that?
True. Well, PTSD is associated with acute trauma. In this scenario, the condition most likely will not be that acute. We're all expected, bearing in mind that there's a lot of talk about it and people are already preparing themselves and aware of the risk of loss of a loved one. But regardless, if an individual in the unlikely scenario develops PTSD symptoms associated with this, there's required specialist attention, and there are several specialist services available. Thank God they are growing in the country. They are not as many as we would like them to be, but yeah, the treatment is technical, yes, but all I can say pretty much, summarize on the LL here now would be that they should observe if their sleep is compromised. If they're having difficulty sleeping, if they're having intrusive thoughts that they cannot control, if they're having flashback of the flashback refers to...
Now, because we have to go, I'd like to say a big thank you to you for your time and for, adequately explaining this to all of us. Thank you for your time, Doctor.